Cardiac electrophysiology, also referred to as clinical cardiac electrophysiology, arrhythmia services, or electrophysiology, is a branch of the medical specialty of cardiology and is concerned with the study and treatment of rhythm disorders of the heart. Cardiologists with expertise in this area are usually referred to as electrophysiologists. Electrophysiologists are trained in the mechanism, function, and performance of the electrical activities of the heart. Electrophysiologists work closely with other cardiologists and cardiac surgeons to assist or guide therapy for heart rhythm disturbances, arrhythmias. They are trained to perform interventional and surgical procedures to treat cardiac arrhythmia. The training required to become an electrophysiologist is long and requires 7 to 8 years after medical school, in the U.S. 3 years of internal medicine residency, 3 years of clinical cardiology fellowship, and 1 to 2, in most instances, years of clinical cardiac electrophysiology. An electrophysiology study is any of a number of invasive, intracardiac, and non-invasive recording of spontaneous electrical activity, as well as of cardiac responses to programmed electrical stimulation. These studies are performed to assess arrhythmias, elucidate symptoms, evaluate abnormal electrocardiograms, assess risk of developing arrhythmias in the future, and design treatment. In addition to diagnostic testing of the electrical properties of the heart, electrophysiologists are trained in therapeutic and surgical methods to treat many of the rhythm disturbances of the heart. Therapeutic modalities employed in this field include antiarrhythmic drug therapy and surgical implantation of pacemakers and implantable cardioverter defibrillators. Scope of practice, tests, and procedures. Diagnostic testing. Ambulatory electrocardiographic monitoring, Holter and event monitor recording and interpretation. Tilt table testing. T-wave alternance testing. Signal averaged electrocardiogram, SEEC, interpretation, also referred to as late potentials reading. Electrophysiology study, EPS, consists in the insertion of pacing and recording electrodes either in the esophagus, intraesophageal EPS, or, through blood vessels, directly into the heart chambers, intracardiac EPS, in order to measure electrical properties of the heart and, in the case of intracardiac EPS, to electrically stimulate it in the attempt to induce arrhythmias for diagnostic purposes, programmed electrical stimulation. Medical treatment. Initial administration and monitoring of the effect of drugs for treatment of heart rhythm disorders. Electrophysiologists are often involved when severe or life-threatening arrhythmias are being treated, or when multiple drugs must be used to treat an arrhythmia. Catheter ablation. Ablation therapy, catheter-based ablation of lesions in the heart, with radiofrequency energy, cryotherapy, destructive freezing, or ultrasound energy, to cure or control arrhythmias, see radiofrequency ablation. Ablation is usually performed during the same procedure as the electrophysiology study, which induces and confirms the diagnosis of the arrhythmia for which ablation therapy is sought. Non-complex ablations include ablation for arrhythmias such as AV nodal reentrant tachycardia, accessory pathway-mediated tachycardia, atrial flutter. These procedures are usually performed using intracardiac catheters, as are used during an electrophysiology study, fluoroscopy, a real-time X-ray camera, and electrical recordings from the inside of the heart. Complex ablations include ablation for arrhythmias such as multifocal atrial tachycardia, atrial fibrillation, and ventricular tachycardia. In addition to the apparatus used for a non-complex ablation, these procedures often make use of sophisticated computer mapping systems to localize the source of the abnormal rhythm and to direct delivery of ablation lesions. Surgical procedures, pacemaker and defibrillator implantation and follow-up. Implantation of single and dual chamber pacemakers and defibrillators. Implantation of biventricular pacemakers and defibrillators for patients with congestive heart failure. Implantation of loop recorders, implanted ECG recorders for long-term monitoring of ECG to allow for diagnosis of an arrhythmia. Clinical follow-up and reprogramming of implanted devices.
Please subscribe and thanks for watching.